Some important developments.
Referring to the fact that this virus started in China, is that acceptable? Is it wrong? Are you worried that having this virus be talked about as a Chinese virus, that might...
Your own aide, Secretary Azar, says he does not use this term. He says ethnicity does not cause the virus.
I have witnessed maybe 100 people died from COVID.
The worst year of my career was during the pandemic.
I think we go to work even though it's a battlefield because we feel like warriors.
There are about 20 million Asians in the U.S., with ties to more than 20 countries. Asian healthcare providers are disproportionately represented in the field, given their numbers in the U.S. population. Many of the Asian medical professionals have overcome challenges to practice, starting with learning a new language.
I'm a Thai nurse working at University of Maryland.
For many, the career path was unexpected, but not one of those who spoke with VOA wants to do anything else, including Tibetan nurse Sering Dechen.
I was not really sure if I really wanted to become a nurse. Once I started doing my clinicals, and that's when I started falling in love with this profession.
Indonesian nurse Adam Connors arrived in the U.S. in 2011 on a tourist visa to visit France. But almost immediately, he collapsed from a seizure from undiagnosed late-stage tuberculosis. He was admitted to George Washington University Hospital in Washington, D.C., where he now works as a nurse in the ICU.
During my 3-month stay in the hospital, I feel like, wow, I see the nurses, especially, they work really hard, they're so passionate, they try to help the patient. At that time it was me. So from that time, I was decided to be a nurse.
Asian medical professionals working on the front lines of U.S. hospitals marked the past year, witnessing deaths and celebrating recoveries. Lauded as heroes, some have endured racial attacks.
It's similar to the aftermath of 9/11 when folks of darker complexion looked similar to the threats to America. And so now, when we have this pandemic that originated in China, East Asian folks are now considered a threat to America.
Someone shouted a racial slur across the street to me. It kind of caught me off guard because I was walking out of the hospital that day and I was clearly wearing hospital scrubs. and it was strange because on the one hand, especially back then, health professionals were really, we were highlighted as kind of healthcare heroes.
Some people don't want to be tended by Asian healthcare professionals, even though they care for people of all nationalities each day.
People, to me, there's no color, there's no shapes, there's no size, there's no gender, there's none. It's just people. So you take care of it, people as the best of your ability.
Yet, as many families know, sometimes even the best of care cannot protect patients from COVID-19.
The thing with COVID is you don't know how the patients, when they're going to pass away. I was holding his hand and it was kind of warm and then it got cold.
What went through your mind as you were holding his hand and his hand became cold?
I just wished, I was praying that since we are Buddhist, we believe in afterlife. So I was actually kind of at peace because he don't need to suffer anymore. Yeah, and he can have a new start with a fresh life. Yeah.
Sering Dechen contracted COVID-19 last year as she and colleagues removed a patient's ventilator in March.
All of us got sick almost at the same time, and quarantining together, talking about health proxies, signing wills.
As the pandemic enters a second year, Asian medical professionals will continue providing the best care they can to what everyone hopes will be fewer patients. For VOA News, this is Ariadna Budianto.